Hello and welcome to Advanced Women's Health. I am Dr. Sarah Wilson. I am a naturopathic doctor, the founder of Advanced Women's Health, and our clinical director. So today we are here to talk about PCOS. So PCOS, or Polycystic Ovarian Syndrome, is a syndrome. And so what a syndrome means is that it's a constellation of symptoms, and it affects a lot of people. Okay, so when we're looking at the general syndrome, what we expect to see is that oftentimes people are anovulatory, which means they're not ovulating and they are experiencing irregular periods. Can be very long in between periods of time that they get their menstrual cycle. There's also an androgenic component to this condition, meaning that there can be hair growth, right? Male pattern hair growth. There can be male pattern hair loss. We can also see acne. That's pretty significant, right? And then the third component is cysts on the ovaries. And these cysts, we look at them, we call them a string of pearls, right? It's a whole bunch of follicles around the outside of the ovary. And now you need to have two of three of those things in order to get a diagnosis of PCOS. What we also know about this condition is that there's generally about four types. And so some people fit into what we call a metabolic type, where they struggle to lose weight. They gain it really easily. They're told, oh, if you just lose weight, then you'll feel better, which is so unhelpful. I'm just going to put it out there because if you're trying really hard to lose weight and you have a hormone, and this hormone controls your blood sugar, it's called insulin. And insulin, this hormone called insulin, is taking your blood sugar and driving it into your fat cells. Okay. In PCOS, this hormone is also contributing to the lack of ovulation, and it is contributing to high levels of these male sex hormones or androgens, right? That in those situations, if you are trying to lose weight through traditional mechanisms, cutting calories, doing those things, right, that you're told to do, eat less and exercise more, it doesn't work the same way for your body as a lot of other research shows we can make different dietary changes. And so in this situation, there's the metabolic type, right? There is an ovulatory type. So if you have some metabolic issues, right, plus you're struggling with acne, right, you're struggling with hair loss and hair growth, but you have a regular cycle, that actually doesn't rule you out from having PCOS. So that's something that we often investigate. But then there's a lean type of PCOS as well. And so this lean type of PCOS still has blood sugar issues and still has that dysregulation that's occurring. They have the high levels of male sex hormones, but they don't necessarily experience the weight gain associated with it. And in those situations, those people are often still told to lose weight. It just makes me laugh because, again, at Advanced Women's Health, we're evidence-based practitioners. I was a researcher before I was a naturopathic doctor, and I trained my team on those principles. And so we are using the best available evidence to support you in your PCOS journey. How do we diagnose it? How do we get you the right supplements? How do we get you the right pharmaceuticals? How do we get you the right dietary outline? You need a customized dietary outline based on, honestly, minimal blood work. It doesn't mean that we are spending hundreds of dollars on labs to get you the information you need to personalize your healthcare experience and improve your healthcare experience. So if you are ready to dive in and you're like, I want the metabolic assessment, I want to understand my androgens, I want to use diet, lifestyle, supplements, all of these targeted treatments to fully understand your healthcare and finally feel like yourself again, then someone on my team is ready to work with you. Our team is truly collaborative. When we say collaborative, we are truly collaborative. R&Ds meet for an hour every day. We're going through what we call clinical rounds to give you the experience of having the best minds on your case. And so if you are struggling or you need more support in a different area, we also, our practitioners, are working together behind the scenes to make sure that your fertility needs and your metabolic needs, your digestive needs, and all of these other things are brought together and understood. So if you're really looking for a healthcare experience where you feel fully supported, you feel understood, you feel like we're applying research and we can see that progress and that improvement on a predictable basis, then we are here to help you. You can book an appointment with one of our patient onboarding coordinators, or you can book right in if you know who you want to work with, or there's a clinic close to you that has a practitioner that resonates, you can book in with them below. In any situation, I just really want you to know that you can be well, you can feel well, and we are here to help you on that journey. So have a beautiful day, and I look forward to working with you soon.